Okay. So good afternoon. Actually, it's still morning, 11:36. I want to thank everyone for coming, for the committee, for being here. If someone is not at their seat, it's because they're not feeling well and they're home. So I want to take a minute to say thank you for being on time. This is our first session, voting session, my first one as chair. So indulge me if I make some mistakes, okay? And I want to thank staff, the council and staff for getting our bills together. I have a couple of announcements. First, I want to wish Delegate Kaiser a happy birthday. We hope you have a blessed, wonderful weekend and an amazing year. And second, I have a shadow of the day, Ms. Emmeline Cipher and her mom, Ann Cipher. Want to get up? And I want to say, she has been with me. I have Anne Arundel delegation at 8:30, and I have Prince George's delegation at 9. And she came early. She was there already at 8:15, and we logged on to both delegations and voted. And then I had a couple of meetings. She sat through it. We walked to the floor. So she is a delegate today. So thank you. So we're going to start our voting session, the voting list. Everyone got it. So the way it's going to work is that the staff, more specifically Michelle, will send you the package that was put together, and you have it. There are 4 bills today that we're voting on, and attached to the package are the amendments, okay? So I also want to, for the new people, when we have a bill that is favorable with amendment, as you see 2 here, we are able to add co-sponsors if you were not on the original bill. If there is a bill that says favorable, we will not allow co-sponsors, because what happens is that on the floor, then it's favorable with amendment, and the person has to get up and read the amendment, and it opens it up for questions, right? We want it to go smoothly, and I would like my chairmen to have an easy time on the floor to the extent possible, so that you know what the rules are. So if it's favorable with amendment, yes, we'll pile on. If it's favorable, no, because we want our 4 chairs. It's kind of, it's really nerve-wracking when you're on the floor and you don't know what's going to be asked. Those are going to be the rules. When you see a W, means that the delegate withdrew it, and we have to do a motion to accept that withdrawal. And those are usually with letters. And there's a little competition between the 3 council. So whoever gets the most withdrawal wins something. Just kidding. Anyway, we're going to get started. We have the first one is House Bill 286, which is Delegate Chetty, is perfusionist licensure exemption, employees and agents of federally designed designated organ procurement. Thank you. Is there a second? All those in favor? Aye. Any opposed? Wonderful. It's unanimous. The next one is House Bill 214, Delegate Kelly, Commission on Public Health. Aaron.
This bill establishes a Commission on Public Health to make recommendations to improve the delivery of foundational public health services in the state. There are amendments which alter the composition of the commission to include 3 local health officers. It adds 3 to 5 members of the public with demonstrated interest in public health. It moves the HSCRC and MHCC to a consultative role and adds other state agencies on consult. It requires the commission to establish certain work groups that contain 2 members of the commission and members of the public, and it adds a diversity clause for commission and work group members. Amendment number 2 requires the commission to assess the foundational public health capabilities of the Maryland Department of Health and local health departments, and requires the commission, in conducting the assessment, to explain the impact of the foundational public health capabilities on the state's ability to address foundational public health areas, including the state's ability to respond to COVID-19, overdose, maternal and infant mortality, and other major health challenges. The commission is required to hold at least 3 public meetings, and the recommendations for reform are clarified. In addition, there is an amendment that adds an interim report and moves the final report date from October 1st, 2025 to December 1st, 2024.
Thank you, Erin. And for the new people, I then will ask Delegate Kelly, who's the chairman of the committee, to explain the process and the amendments. Delegate Kelly.
Thank you, Madam Chairman. So the Public Health and Minority Health Disparities Subcommittee met for 2 weeks to discuss this bill, and it was voted out with a consensus of all of the members on the subcommittee. There were a lot of these amendments were contributions from stakeholders like Delegate Chisholm and Delegate Lewis and Delegate Bagnall. So the amendments basically include all of the feedback from all the members of the subcommittee, and what we ended up with was a commission with about 13 to 15, but probably 13 members, and then work groups, which is sort of the model that we've used with other groups where we have a lot of stakeholder interest. So that was the discussion that we had in the subcommittee. We also discussed ensuring that the scope of what this commission is looking at is narrow and focused on those foundational public health elements, and it has very specific recommendations that we're looking for. We did not want to create a commission that was broad, wide-ranging, and given free rein. So it has very specific recommendations and a reporting timeline that is narrow enough that we're looking for a really productive report and series of policy recommendations. And with that, I move the amendments.
Is there a second? Is there discussion on the amendments? Seeing none, is there a motion on the bill as amended?
Do we vote on the amendments? I think we have to vote on the amendments.
Move the amendments.
They were moved in second, and all in
Wonderful.
favor.
All in favor? Aye. Any opposition? Seeing none is unanimous.
Move the bill as amended.
All right, on the bill as amended, all in favor? Aye. Any opposition? The bill passes unanimous. Are there sponsors? Anyone wants to be a sponsor? Can you raise your hand and staff will go ahead and take your name? Can you say your name out loud, please? Let's start to the right. To my right here, Rosenberg. Anyone else? Okay, wonderful. So you will all be co-sponsors of the bill. Thank you. Thank you very much, Delegate Kelly, for your hard work. Thank you to the Subcommittee on Public Health for working together to create a great bill. I appreciate it. Next, we have House Bill 279, and that is Delegate Collison, Prescription Drug Affordability Board, Opera Payment Limits, and that is Lisa.
House Bill 279 is an emergency bill that reinstates provisions of law regarding the authority of the Prescription Drug Affordability Board to set upper payment limits and related requirements. By December 1st, 2026, the board is required, in consultation with its stakeholder council, to report to specified committees of the General Assembly on the legality, obstacles, and benefits of setting upper payment limits on all purchases and payer reimbursements of prescription drug products in the state, and make recommendations regarding whether the General Assembly should pass legislation to expand the authority of the board to set upper payment limits to all purchases and payer reimbursements of prescription drug products in the state. There were no amendments.
Delegate Collison.
Thank you very much, Madam Chair, and thank you, Lisa, for that explanation. We had a good discussion on this, and as I will remind folks, this is a reinstatement of a board that has been implemented for 3 years, although it's been crippled by some events outside of their control in terms of budgeting and COVID, of course, and the selection of the stakeholder committees. Basically, the board is designed to provide the information that we need as a state in order to make decisions, policy decisions around how to manage our drug spend on for state, any state policy that we have, and other local policies can be included as well. So the board has been working over the last 3 years. It has produced 2 reports. One which gives, that speaks to the cost of generics and how the cost of generics has been increasing over the years and where the increases seem to come. And the second is The second report is the kinds of factors that they are considering in looking at in terms of the upper payment limit process. And I need to emphasize that that process will be approved or not by the Legislative Policy Committee. So the board is not totally independent. It will be under the guidance of this body. And, there were a couple of questions that spoke to, how it was funded. It is currently funded primarily by fees on every entity that relates to life and health insurance over the state of Maryland, and that's a $1,000 fee. Anyone who participates in that, it's $1,000 a year. That's all it is. That budget is spent primarily on staffing and infrastructure for the board itself. That budget is transparent and can be seen on the board website. So the bill passed the subcommittee 8-3, and with that, I move the bill, Madam Chair.
Is there a
Move favorable.
second?
Right.
There's a second. Is there a question or discussion? Seeing no questions, no discussion. All those in favor, you have a question? Okay, thank you. She moved it already, and it was second. So all those in favor say, oh, you have a question?
Amendment.
No, there are no amendments.
Oh, okay. So we're on the bill.
Yes.
I think we have a difference of political ideology on this. There's many in the Republican Party that feels that we believe in free markets, and price controls ultimately end up in rationing. And bills like this, I feel that, if there is a situation, and I know there's metrics in the bill that prevent rationing. Look, to me, if you told a manufacturer they need to sell a drug at a certain price, to me, they're going to sell it in 49 other states prior to selling it here. And if constituents can't get the drugs that they need, well, that's a big problem. So unfortunately, I think I have to vote no to this bill. I just want to state that. Thank you.
Thank you. Yes, Delegate Collison, Chairman Collison.
Thank you very much for your input. I appreciate it. I understand the philosophical differences. First, I want to be really clear that we're only saying what Maryland will pay. We're not telling the company that they can sell the drug at that price. That would be unconstitutional. But we can tell them, this is how much we will pay. There's lots of evidence of this kind of program through the federal government. The federal government is doing it all the time in Medicare. And so, and we haven't had a shortage in the country. And I believe that the state of Maryland is a big enough pharmaceutical market that the manufacturers will still want to sell in Maryland, even though, and I think the upper payment limits, if they are set, will be reasonable. And so I think, for that reason, if we're going to manage costs, we've got to draw some lines somewhere, and that's what this board is designed to help us do. The board doesn't do it. It helps us do that. So thank you, Delegate.
Delegate Chisholm.
Thank you, Madam Chair. I think
My
I just
pleasure.
found it. So when they were here the other day testifying, they seemed to be able to tell us a lot of what they haven't been able to do. And I just found that, I guess we have, the next report is due December 1st, 2026. Is that correct? And
Are required to report every year to us on their activities.
then that report will go to the commission, correct?
Well, all the reports come to the General Assembly, to this committee and Finance. The December 2026 report, and that's sort of setting a goal line for any recommendations that they have around the upper payment limits. So there's lots of other work that's going on in the meantime, but they are, by December 2026, we are hoping that they'll have guidance for us around upper payment limits.
And they've done 2 reports so far, and did they make any recommendations that would have yielded a lower prescription price that you recall in those reports?
They they're working on programs. They mentioned the insulin program that they've worked with manufacturers on to actually provide free insulin to folks who cannot afford it. And that partnership is happening. As Mr. York pointed out to us, a resident of Maryland can actually call the board and have them work with them to find a lower price drug at some point. So it's available to constituents as well.
And one last question.
Sure.
And just for a point of reference, I know that the state of Maryland, the Department of Health was unfavorable. Did you meet with them to smooth over whatever their big concerns were?
Thank you for reminding me of that. I was supposed to mention that earlier. Yes, Mr. York actually met with the director of Medicaid and explained the difference between what the federal FULs are and our UPLs, potential UPLs, and that they would not conflict. And the process that the board will use to make recommendations around upper payment limits is considering a number, I think at the last meeting was like 13 different factors. And one of those factors would be any potential negative consequence to the way the state now pays for drugs. So the folks in Medicaid were assured or felt assured that we'd addressed their concerns and were, I didn't ask them to say whether or not they supported it, but they said they no longer had an issue.
Thank you, ma'am.
Thank you for your questions. They're great, and it helps prepare to the floor, and we're extremely grateful, and we welcome them. This is the space, and I thank you for doing that. The bill, are there any other questions, Delegate Bandari?
Yeah, thank you, Madam Chair. Rather than the question, based on my research on this bill, that we had one of the concern how these drug companies will react. Based on my research, it will increase competition. An upper payment limit can encourage these pharmaceutical companies to compete on price, which can lead to lower drug price for consumer. And also it increase transparency, it can provide valuable information about drug pricing and the utilization pattern, which can help us, policymakers and healthcare providers, make informed decisions about how to address the rising cost of the prescription drug, and this is a wonderful bill. Thank you, Madam Chair.
Thank you. Any other comments or questions? Seeing none, the bill has been moved and second. It has no amendment. All those in favor say aye. Aye. Any opposition? All right. You got that? You got it? All right. Wonderful. Thank you. Thank you very much, and Delegate Collison, thank you for your hard work and for working with,
Could we announce the names that were recorded as well?
absolutely.
So we don't miss anybody?
Yes, go ahead. Will you be so kind and raise your hands again? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, and Delegate Riley. Thank you. Thank you. I want to just thank you for the hard work and bringing everyone to the table. I know you have been working on this for years, so, we thank you. The next bill, and it's our last bill that we're voting on this Friday, is House Bill 611, and it's Delegate Kelly. It is the State Board of Nursing Sunset Extension, Licensure Exceptions, and Board Operations and Membership. Lindsay.
This is an emergency bill that was heard by the full committee yesterday. It extends the termination date for the State Board of Nursing by 2 years to July 1st, 2025. Through June 30th, 2025, the Secretary of Health will have authority over the infrastructure operations of the board, for which board special funds may not be used. The terms of board members in office on the date the bill takes effect are terminated on a staggered basis beginning July 1st, 2023. The bill requires the board to hire an external consultant to conduct an independent evaluation of the board to develop an action plan as specified and report by September 1st, 2023. The board must report on specified processing times by December 1st, 2023. The bill also alters exceptions to registered nurse and licensed practical nurse licensure requirements and expands the required contents of the board's annual report. There are amendments that begin on handwritten page 6 in your packet. This is a reprint of the bill, so this shows the bill with the interlineated amendments in the text. So I'll walk through what these amendments are. What you see on page 6 is technical changes to the purpose paragraph and function paragraphs. The next change you'll see is on handwritten page 9 of your document. In line 5, this is a technical change that just clarifies the licensure exception applies for the 120-day period immediately following rather than preceding the submission of an application to the board. On page 10, the lines that appear below line 13 clarify that the infrastructure operations that will be taken over by the Secretary of Health do not include policy or regulatory decisions of the board. Looking at page 11 and on to page 12, this language is struck from the bill that would have removed the requirement that the executive director of the board be a registered nurse starting in 2025 when the board regains control over the staffing of the board. Remaining on page 12 in line 9, there is clarification that the external consultant hired by the board to do the independent evaluation should be approved by the Secretary of Health. Also included in this external evaluation of the board is an evaluation of the qualifications necessary for the executive director. So it was removed from the bill, the change that would have removed the requirement that the executive director be a registered nurse, and instead that's going to be studied as part of that evaluation. On page 13, in lines 26 and 27, the timing of the termination dates for the board members is altered, and instead it will be done in 2 batches rather than 3. And the last change on page 14 that you'll see is just a technical change that aligns with the removal of the language relating to the executive director qualifications.
Thank you, Lindsay, for your work. Delegate Kelly.
Thank you, Madam Chairman. And I know the committee is familiar with this bill because we just heard it recently. I just want to make sure the committee has the update that the last amendment that Lindsay explained was the amendment that Ms. Evans was talking about, that we could, requesting that we change the staggering of the board reconstitution so that it only happens twice, 6 months apart, instead of 3 times. But that still allows us to complete the board reconstitution by November. Also want to remind the committee that this legislation is going to result in an influx of $10 million worth of general funds into the Board of Nursing to help them with their administrative problems, as well as really important support that they're going to need. We have a meeting scheduled on Monday with the Secretary of DBM, as well as the Secretary of Health and the Executive Director of the Board of Nursing to get started on this important work. It is an emergency bill. And the last thing I just wanted to tell you all is we got late testimony submitted from, again, new members of the committee might not remember Shirley Devaris, but returning members remember her as working with the Board of Nursing for many, many years. And she wanted to let us know that she wholeheartedly supports the bill. And there's a time when she would have strongly opposed departmental intervention in the board, but times have changed, the requirements have grown, and management has not been able to keep up, and that she wishes us the best of luck in these efforts. So I just want to make sure the committee knows that. And with that, I'm going to move the amendments.
Is there a second? Is there discussion or questions on the amendments in the bill? Seeing none, all those in favor say yes. Aye. Aye. Any opposed? Any opposition? No, not yet. We have to move the bill. On the bill, seeing none, on the bill as amended, is there a motion? Second. It's been moved and second. All those in favor say aye. Oh, you have a question?
It's not going to change my vote on the bill.
Go ahead.
But I am curious, one of the things that's not addressed in here is it seems like one of the largest challenges they face is with Do It. If this bill passes, is it going to give you more leverage over Do It to get the job done? Because it seems like the technical aspect of getting the licenses out is one of the biggest challenges they face.
Yeah, so part of the study that is required in the bill, part of the work of the external consultant that is required in the bill requires that DO-IT come together with DBM and the Board of Nursing to come up with the plan. So that's written into the bill.
Okay, thank you. Thank you, Madam Chair.
My pleasure. Any other questions? All right, all those in favor say aye. Any opposition? Seeing none, the bill passes unanimous and is favorable with amendment, which means that you can pile up. Who wants to be on the bill? Actually, who doesn't want to be on the bill? Just raise your hand. See, I got that right. Okay.
Online members, are the online members able to co-sponsor because they're not here?
No, they can't vote and you're not allowed. Anyway, so I just want to say thank you. This was a very tough bill, challenging, and you have been working on it. Delegate Kelly worked on it very long and met with many people for months since the summer. And Lindsay, thank you for providing the support. We really appreciate it. So this concludes the voting, but I would like to ask my shadow for today, how would she have voted on these bills? Emmeline, how will you have voted on House Bill 214? So yes or no? Or Mom, how will you have voted on 214? All right. On 279? On 611? Thank you. And tell me what your mom does. What is her job? And what's your dad? What does he do? All right. So is there a conflict there, guys? No, just kidding. Anyway, thank you for being with us. And I want to thank Marshall for being with us this week and staff, every single one of you for your hard work. We do have an announcement is that we have a briefing on Monday at 2:30. So please be here on Monday at 2:30 because we do have a briefing. Do you have a question?
If I can beg just a moment, I had the first thing on my list about the Board of Nursing bill was to thank Lindsay. I just want the committee and everyone watching to know she worked for months and months, dug really deep in this and learned more about the Board of Nursing than probably anyone needs to know in the world. And her efforts on this were tremendous. So I just wanted to note that.
Okay, so thank you so much for being with us, and staff, thank you for getting us through a very interesting, busy week. And I hope you have a blessed weekend. And I'll see you on Monday at 2:30 sharp in the committee. Thank you. Take care.